think it was 55 operational incident command days that we were coming together. And the really interesting thing is it feels like it was so much longer, and then other times it feels like it was so much shorter.
Yeah, when we trained for crisis management and going into incident command, we never trained for more than a day or so, and so I don't think we expected to live in that bubble for as long as we did. And really, your sense of time gets obscured because you don't go anywhere, and it's happening. The response is 24 hours a day, and so. Really, this next segment's going to lay out the timeline from the beginning of incident command until we went to recovery of operations, and there are a lot of milestones in there.
In January and February, COVID-19 was active internationally and in other areas of our country and really came onto our radar screen. On March 3rd, Chief Medical Officer John Minadeo sent out an email to the medical staff and the management staff and said, we have to take this seriously. On March 5th, we received our first media inquiry questioning, could this really come to Vermont? On March 6th, we established Incident Command to provide for a special way to run this hospital in the face of an emergency. On March 8th, Vermont experienced its first positive case. It was at the other end of the state, but still it got our attention that our preparation was absolutely necessary. On March 9th, we instituted significant change to reduce the chances of transmission. We limited ourselves to 2 entrances to the building and established screening. We restricted visitation to our patients. We sent our volunteers and our valets home. We suspended public use of our courtyard cafe and our conference center. On March 12th, we had a remarkable flurry of activity. We established the Incident Command Center to bring all of our leading voices in the response into one room, socially distant, to run this response. We established curbside testing so patients could drive to the hospital and get their tests. And we dedicated a patient care wing to the treatment of COVID-19 to allow us to provide proper isolation. On March 19th, we began rescheduling elective surgery. On March 20th, we established an employee well-being unit to wrap around the mental health needs of our staff in this incredibly stressful time. March 21st, Franklin County had its first positive test. So COVID-19 was here in our community and we were ready. On March 24th, NMC partnered with the Vermont National Guard and Collins Pearlie to establish a field hospital at the complex in case the demand exceeded NMC's capacity. On March 26th, NMC established a mobile testing service to meet the needs of special populations throughout Franklin and Grand Isle County. March 27th was a powerful day for NMC because we had our first employee test positive. While it was a case of community transmission, not acquired here at the hospital, it still rattled our staff that one of our own had contracted COVID-19. On April 1st, Grand Isle County experienced its first positive COVID-19 test. So now COVID-19 was throughout our entire service area. On April 4th, the recommendation regarding cloth face masks was issued, and that was a turning point for us in prevention. On April 12th, to meet the continued demands here at the hospital campus, we closed our urgent care center in Georgia and consolidated that staff to St. Albans. On April 15th, we extended our cancellation of elective surgeries because it wasn't yet safe to bring folks back into the facility. By April 24th, we had begun to see the curve change and volumes begin to diminish as preventive steps took hold. We began planning to phase back to a new normal. That included plans for reestablishing surgery, how we would maintain COVID isolation, and the closure of the field hospital at Collins Pearlie. By May 11th, we were ready to restart elective surgery and to begin to restart in-person care. Over the next 6 weeks, we slowly phased back into in-person care and elective surgery following the guidance of the CDC, Dr. Mark Levine, and the Vermont Department of Health. Now our timeline continues forward with everything we do being looked at in light of what's safe for patients, what's safe for staff, and how do we meet community need.